Sobering new data from the CDC lifts the lid on the rapidly worsening mental health crisis among American teenagers. In the first half of 2021, 4 in 10 teens reported that they felt persistently sad or hopeless. 1 in 5 said they'd contemplated suicide, and tragically, 1 in 11 said they'd attempted suicide. Conducted in the midst of their first full pandemic school year, the study finds that persistent feelings of sadness or hopelessness were more common in girls and gay, lesbian, and transgender teens. And teenage girls were twice as likely to have suicidal thoughts during this period as boys.
There's little doubt, however, that the pandemic and related closures played a significant role in worsening teens' mental health outcomes, regardless of their demographic. Between 2009 and 2019, the percentage of teens who reported persistent sadness rose from 26% to 37%. In 2021, the figure rose to 44%. Our rising panel joins us now to weigh in. John Iadarola is host of The Damage Report and The Young Turks, and Rachel Bovard is policy director at the Conservative Partnership Institute. Welcome to you both.
Good morning.
Hello. So, Rachel, what do you make of these numbers? You know, I think this is in some ways a difficult thing to measure over time. I think there has been a greater openness to talking about mental trauma. Young people are much more comfortable admitting that they have some kind of mental trauma, and thus, to an extent, it looks like it's getting worse, but people had mental health problems before. They just weren't as willing to admit them. I think that is part of it, but then there's also something beyond that is true, that it is getting worse, and it's hard to understand why, although it's obvious, I think, to many people, most people, that the pandemic played at least some role in that. What's your reading of this?
Yeah, I think there are obviously exacerbating factors, the biggest of which recently was the COVID lockdowns. And, I think what was really tremendously important about this story is the fact that we couldn't even talk about for a long time what the pandemic and the lockdowns were doing to kids. If you remember 2 years ago, that was verboten. If you mentioned it, if you said at all, school closures could be hurting kids, you were called a grandma killer. You were saying, you were told you weren't taking the pandemic seriously. But obviously, this was going to have an impact on the mental health of children. Children are not adults. They're not mini adults. You cannot treat them that way. And on top of that, we know that socialization protects kids from a lot of stressors in their life. So I do think that the lockdowns played a significant role. And I think, now that we look back in hindsight, a lot of adults, that made those decisions are going to have to grapple with that responsibility. But it was more than that as well. I've written about this many times. I know, Robbie, you and I potentially disagree on this, but I do think the role of social media here does play a significant part in the mental health, particularly of teenage girls. Now, not everyone, right, that gets on Instagram is going to suddenly develop suicidal ideations, but I do think it plays a role in how teens view themselves and how they view the world. And that is something that we just simply haven't grappled with. And it's not the same, as the video game debate of the 1990s. This is a ubiquitous technology that schools even use, absent parents. And so I do think we have to get a handle on how this is impacting, kids as they grow up, as they interact with people, because all of this, I think, is having an obviously detrimental effect on their mental health.
John, is it possible to talk about this and to acknowledge the toll that the pandemic has taken on the mental health of young people without politicizing the conversation or getting into a back and forth about grandma killing, or undermining the reality of some grandma killing being the effect of being more lax with certain kinds of COVID policies?
Well, if we use the term grandma killing, then yes, hackles are going to be raised, I guess. It is a topic that is, in a variety of ways, directly attached to politics, so it's probably going to get political, but I don't fear that. I think it is fairly clear that the lockdown, to the extent that the United States ever really experienced a lockdown, certainly contributed to some of these feelings for kids. Why wouldn't it? Even though the study that this is being drawn from says that specifically school lockdowns can't be separated, the effect of that can't be separated from broader lockdown measures, why wouldn't it have an effect on them? It's had an effect on literally everyone. Who's doing better wellness-wise than they were a couple of years ago? But I also think, as has now been acknowledged, exactly, as has now been acknowledged, it is also possible that some of those feelings of sadness and depression might be related to losing people that they love. We have an epidemic of new orphans over the past couple of years. I have lost a family member. That contributes to some sadness. So that is definitely the case. But I also think that and we've already started to talk about things like technology, those sorts of things. We can't exclusively focus on this, because if we do, well, the lockdowns are effectively done. The kids are back in school, but this crisis is not going to go away. And if we think, well, job done, we solved it, they're back together, then I think we're going to be doing the kids a massive disservice. The numbers were way too high back in 2019, way before the pandemic.
Yeah. Going back to social media, Rachel, I don't totally disagree. I've looked at the case against Instagram specifically, and yes, it seems like a specific demographic of the users, the teen girls, some of them, not all of them, not even most of them, but some of them are having a negative experience with the platform, specifically, because of the way it presents the body issues, issues that have existed for young women in other contexts with other media, but are very pronounced on Instagram. Is it so I want to always empower parents to feel like, I'm not going to say this is not a problem. You should exercise more control if your kids are struggling with this, or maybe to preempt them ever struggling with it. Exercise more control over this. I don't know at what age parents are giving their kids phones these days, but it's not high enough. It needs to be later, right?
So I do hear this a lot, simply that this is a parenting decision and better parenting will solve this. I sort of reject the binary framing of this as either or, because I think it's both. I think obviously parental choices make a difference, a huge difference. When or if you give your kid a smartphone matters. But I also think that this is, again, technology that exists, everywhere. If you just look at the schools, for instance, right? Google is handing out free Chromebooks to schools all over the countries. And this is not out of benevolence. It's about the fact that they want to clientize these kids, and they do very successfully. Many teachers use, the Google Education Suite, which requires students to have a YouTube account. We know that Google is collecting data to create user profiles on kids under 13, and a federal judge has ruled that's legal. Even though federal law says you're not supposed to do it, schools are consenting on behalf of parents, so that's legal. Public school teachers in my own family use Facebook, use Instagram, closed accounts to facilitate, especially through virtual learning, the social interaction, that does help kids learn and interact with their peers. So this technology is everywhere. It's not simply that you can opt out of it. And I think that's
right.
The reality that we're dealing with, is kids confront it in ways that simply, parents can't simply just turn off or oversee at all
Sure.
times.
Well, and to the extent it's, wrapped up in public school policy, we are in the realm of government policy, and I would probably agree with you on most of those criticisms that we should look at not doing that.
Well, I'm also curious what you think the response should be from a mental health perspective. Part of this is these private corporations pushing their products and their ability to collect data on young people. What responsibility is there, do you think, to facilitate mental health services to these kids and to these families who might otherwise not be able to afford it?
Well, I think we haven't even gotten to the point where we can acknowledge the problem. I mean, we are just at the tip of the iceberg to acknowledge that these platforms even have a mental health component to them. I mean, you've seen the companies deny this repeatedly. I think Instagram, and Facebook are finally being forced to admit, based on internal documents that were leaked, that, okay, we do know there's an addictive nature here. But I think more broadly, we have to recognize that the entire business model of these platforms is premised on addiction. It is premised on sucking you down these algorithmic rabbit holes from which in some children never recover from. That is the business model. So if that's what we're pushing out, then yes, we're obviously going to need some mental health services. And this is something I think schools really need to be aware of, and parents need to be aware of. And we're just starting to have this conversation. So we can't even talk about the remedies yet, because we haven't even focused on, I think, the problem and how big it actually is.
Well, we got to leave it there. John, Rachel, thank you so much for joining us.
Thanks, guys.
And we'll have more Rising right after this.